Hi guys, Dr. Gillard. Now this is the presentation that I gave the Monday spinal palpation lab section. You guys didn't have it because you were off Tuesday, so I thought I would make a YouTube video out of it real quickly so you didn't get cheated out of a presentation. Now all this material will be fair game for the final. And I will have pictures of real x-rays, glossy pictures, and you'll have to identify it. I think I went over that in lab with you all. So here we go. Let's see what we can see here. So the object here is to refresh the basic spinal anatomy and neural spinal anatomy. We're going to learn to identify radiographic appearances of typical vertebral structures. And I always like to throw this in. Remember, we are experts. Doctors of chiropractic are experts in the spine, and we're right up there with spine surgeons and maybe PM&R doctors. I'd like to think that our training is well above that of a general physician. In fact, I know that to be true. So pay attention to this stuff because this is going to set you apart from the crowd. All right, the basics. There are 7 cervical vertebrae. This is obviously a PA view of the spine. There are 12 thoracic vertebrae. There are 5 lumbar vertebrae, 5 sacral segments, and 3 to 5 coccygeal segments. Now there are some basic curves that are in the spine. We have a kyphotic curve here in the thorax, and a lordotic curve here in the lumbar spine, and there's a lordotic curve in the cervical spine we'll talk about for when we do this lecture for the final. Let's see, what else do we need to say here? Between the vertebral bodies, of course, here's the let's go through the whole thing. This sacrum I like to call, and when you can use this kind of analogy when you talk to lay people, this is kind of the base of the tower. And on top of the base of a tower, you have these vertebrae stacked off. And the vertebrae has 2 parts, has a vertebral body, and it has a posterior arch. The vertebral body is what's stacked off in front of the kind of the base here. And also make sure you know what a motion segment is. I was surprised how many of my 8th quarter students didn't know what a motion segment was. Motion segment is a vertebrae disc vertebrae sandwich. This is the L4 L5 motion segment. This is the L5 S1 motion segment. This one between L1 and L2, this is the L2 motion segment. That's the functional unit of the spine. The motion segment is the functional unit of the spine. Here's a to P view again of cartoon. Here's a lateral view. Lateral view, we can see the neural foramina, right? Or I guess we call them the intervertebral foramen. You can certainly call them the neural foramina or neural foramina. But the bottom line is these are the holes where the exiting spinal nerve roots leave the spine and then go off in this region to supply every muscle in your leg, the skin, the blood vessels, everything. The nerves have to, this is where they communicate with the CNS. It's where the CNS meets the PNS through these neural foramina. Now this is called an oblique view. It's particularly important because we can see a very common spinal condition called a spondylolisthesis and a spondylolysis. We can see the pars interarticularis real nicely here, and we can see the facet joints as well. So this is called an oblique view. Oblique view. And here's a posterior to anterior view. Anterior posterior view was over here. Muscles of the spine here, complements of Netter here. This is from, you all have Netter, so I felt that I could put this in here since everybody already has it. It's a required text for us. So we have basic muscles. Remember, you're going to have to tell me the sacral, or the first question you'll have when you come in the door is name the 3 components of the rector spinae muscle in the lumbar spine. And you're going to say iliocostalis lumborum, longissimus thoracis, which is down here as well, and then spinalis thoracis. Remember that one starts where? It starts at L1 and L2, so it is part of the lumbar spine. Okay, so don't forget that. Then they continue on up in the thoracic spine as well. Don't forget these covering muscles, serratus posterior inferior, serratus posterior superior, cover these muscles. You have the external oblique. There's the there's the transverse abdominis muscle as well, which is deep to the internal oblique, which is deep to the external oblique. Notice that they do come around to the posterior side. These are not just abdominal muscles. Okay. So now this is important here. You got to know all these nooks and crannies of these bones. This is what your test is going to be like. So this is a what? Vertebrae disc vertebrae. So this is a motion segment. Specifically, it's the L3/4 motion segment. So we have some parts here. We have a spinous process that would be coming out of the plane of the page. We have the lamina, which would be here. Lamina, we'll see this better in different views. We're going to go through all the different views. This view is particularly good for this projection here. It shows the articular pillars quite well. The articular pillars are made up of a superior articular process, which is all of this. Superior articular process. Inferior articular process is below here. At the very top inner part of the superior articular process, you have the facet. This is the facet of the superior articular process. The it connect. Well, we can look here. Here's the superior articular process here. The facet we can't see because it meets with the facet of the inferior articular process. Together the two make up the facet joint, or better term is really zygapophyseal joint or Z joint. The anatomists and researchers across the pond always get upset with Americans because we coined the term facet joint, and this is not a good term because there's facets all over the body. For our midterm for gross one, remember there's facets on the tibial plateau, and there's facets down in the ankle. There's facet joints everywhere. So not a great term, but unfortunately the literature is just full of everything or just full of the word facet. So I like the word Z joint or zygapophyseal joint better. But what are we going to do? Now this is this last quarter. This space gave people fits right here. And we'll see this on x-ray, and it's called the interlaminar space because it's between the lamina. Here's the lamina of L3, and this is the lamina of L4. So it's interlaminar space. It's between the lamina. And let's see, we did the inferior articular processes, we did the lamina. All right, I think that, let's do our mammillary process, right? Here's a nice mammillary process. Remember we tried to palpate those? There's the mammillary process coming off the what? The inferior lateral part of the superior articular facet. Mammillary process. And there's an accessory process. These are muscle attachment sites here. Now these little airplane wings are the transverse processes. There's another transverse process. And I think we got everything covered there. So make sure you study this before you go on to the x-rays or you're going to be lost. And here we can see the disc sneaking in here. And we can also see the vertebral canal. Well, we can't really see it, but it would be behind. It is behind this posterior arch here. All right, let's go to the next one. All right, so make sure you know all these points. Let me give you a minute you can pause it and quiz yourself. Okay, got them all? So now this is a weird place. This always looks confusing. This is the pars interarticularis. This is not a very good place to see it though. So we'll hold that thought. Here's the superior articular process, all of this, 6. Mammillary process is here. It's not a very good drawing. It should be much bigger. There's the facet of the superior articular process. What's that? There's that accessory tubercle. And this is in here. See, it's the lamina kind of morphs into the superior articular process here, so it's kind of difficult to say. But this I would never mark this like that. This is not a good view to see the superior articular process here because you have the lamina right next to it. Okay, make sure I got them all right. Accessory process. Yep, let's go to the next ones. Okay, so what makes up the posterior elements? You can read through that. Now we have a real radiograph, right? Let's go through this. So here's that interlaminar space that I talked about. Okay, here's a nice one on this particular picture. This patient has nice interlaminar space. Although really, we're still inside the body, right? Because now, what is an X-ray? An X-ray is different shades of. Let's see, how can you say this? An X-ray, the harder the bone, the more white. It's called hyperintensity. The more hyperintense something is, the harder the bone is. So let's start here. These are the pedicles. They absorbed a lot of the radiation to make this look white. And then in here, because we have a space between the lamina, it's not a hole completely. The body, the vertebral body, I can outline the body here, and we'll see this a little bit more. This is all the body, but between the lamina, there's less bone, so there will be less density here. So, all right. Anyway, so here's the transverse process. You can see. Here's the non-transverse process. You can see the spinous process outline right here. Okay, so always look when you're reading an X-ray. You always look to make sure to see the eyes and the nose. There's an eye. There's another eye. Okay, and then make sure that the lamina is filled in between the nose. Here's the nose of the spinous process. Now you can see the inferior articular process here of the bone above coming here. Okay, it's meeting with the superior articular process. You can see right here of this bone. Okay, so that forms the facet or the Z joint. Let's get to the numbers here. Alright, so let's go through these now. So 5, it's going to be the, well, it's got the answers right there, but 5 is the inferior articular process. I guess you can read through these. 1 is the pedicle. 2, this is going to be the lamina, all of this region close to the spinous process, which is 3. 6 is going to be the pars interarticularis again. Okay, it's kind of underneath and medial to the eye here, which is the pedicle. Transverse process is there. 5 is the inferior articular process, which you can see quite nicely. Interlaminar space is not marked, but I could put a number like right here, number 8, interlaminar. And let's see, what else do we got? I think that's about it. Pretty straightforward stuff. Here's some things to help you. I've circled the vertebral body here in yellow. Now the disc space, we don't call it the disc, right? Because you can't really see the disc. You can just see a kind of a shadow of the disc. The purple would be where the disc would be. So here's the superior articular process. I don't think we did that yet. So I'm sorry, the superior end plate would be here. Here's the inferior end plate of the vertebral body is here. Oh, what's the question? Do you see any pathology? And I'm not going to test you on pathology. You get plenty of that coming later, but last quarter a couple students picked it out real easily. See it? Look at the transverse processes. Got a fracture right here. Fracture transverse process. So pretty easy to see, right? You follow the margins around and whoops, there's a step here. Displaced. Okay. Now what are we doing here? Oh, you can go to this site if you want. I won't do it because it'll mess up things, but this Radiopedia, you can actually see a CT scan of that same view we're looking at, right? So what's that? Spinous process, laminas would be right here. Articular processes would be over here, or called the articular pillar. The superior articular process and the inferior articular process collectively are called the articular pillar. And you can see the transverse processes. Let's go down one. Anybody see anything weird? Here's that oblique view. Here's an oblique view. It looks a little rare. This is a 3D CT reconstruction. So this is a CT image, so it's not an X-ray image. Well, let's see what we got. So that would be, kind of looks like Scotty Dog here. You'll learn more about that. But there's the eye, so that's the pedicle, this region. Here's the transverse process, this tip right here. That's kind of the nose of the Scotty Dog. And then here's the neck of the Scotty Dog. And that makes up the weakest part of the bone. That's called the pars interarticularis. Gymnasts and football players and people who do a lot of extension, or kids, they can actually fracture that. It can develop into what's called a spondylolysis. And you're going to see them. You're going to treat these kids. So do you see a spondylolysis here? Well, to see a spondylolysis, we have to look at the neck of the Scotty Dog, it's called. We have to look at the pars. This one looks good. Let's look at this one. It's a little weird here, but there's the eye. Here's the neck. It looks smooth. It looks good. What about this one? Oh, look at that. We got a big fracture right through there. So this is called a spondylolysis. Spondylolysis. Spinous process is here again. Spinous process. Lamina would be here. Okay. Now this is a coronal view. This is another CT scan. This is a view from the front. I'm not going to test you on this, but just kind of to give you a glimpse into your future. So here is the spinous process, number 3. Lamina would be here. Articular pillars are this whole mass here. You can see a nice facet joint here. There's the superior articular process. Let's look up at this one. There's superior articular process meeting the inferior articular process to make up the Z joint or the facet. And this region right here, look how thin it is. That's the pars interarticularis. So it's where the superior articular facet meets the inferior articular facet. It seems to favor the toward the superior articular facet in these views, and it actually does in these views. But on an oblique view, you can see it's actually the middle point of where the inferior articular facet meets the superior articular facet. So let's look at this one now. So here's the pars. What about this pars? Broken, right? It's broken. This is another spondylolysis. Okay, this is called a sagittal view or a lateral view, but in radiology world we call this sagittal. And this is a two-dimensional image. It's like now we don't have slices. With a CT and MRI, you get slices through this, so you can actually, computer can reconstruct a three-dimensional image, or you can look at each slice as you go through. But an X-ray is like this thing like your spine got run over by a steamroller, so everything is just a two-dimensional picture. So if that's true, which hole would this be? This is obviously the intervertebral foramen, the neuroforamen, but if everything is smashed flat, it's really the right and the left intervertebral foramen together. You get how that goes? Vertebral bodies are here, vertebral bodies. What's this? What's this vertebrae disc vertebrae combo? Good, motion segment. This is the L2-3 motion segment. What hole is this? This is the L2/3 neuroforamina, because it's both of them. These are the discs, of course. So there's an inferior articular facet there. We can see the transverse process. See them right here. Transverse process coming out of the plane of the page. Easy one right here. Spinous process. What about right here? Tip of the arrow. Inferior articular facet, superior articular facet. This is the L3/4 zygapophyseal joint. Okay, or facet joint. intervertebral foramen. This is interesting too. This L2 vertebral body from the side, or vertebra from the side, vertebra is singular, vertebrae is plural. This is called the inferior vertebral notch. Inferior vertebral notch. This is called the superior vertebral notch, even though it's on the bottom, or it's on the inferior part of the IVF, or the neuroforamina. That's because it's coming off the superior part of the pedicle. This comes off the inferior part of the pedicle. Remember, the pedicle is this region right here. The pedicles make the roof and floor of the neuroforamina, or the IVFs. So, inferior vertebral notch, superior vertebral notch. That's a new one for you. There's the pedicle again. We went through all that stuff. Great. So let's check these out. Here's a sagittal radiographic image of the lumbar spine. So here's the vertebral body. Pedicle would be right here. This guy actually has short pedicles. These should be longer. That's why these look a little bit narrower than normal. But this is the pedicle. We can see this little point here. That's the superior articular process. It meets up with this. So this is the inferior articular process of the bone above. These are very easy here and here. These are spinous processes. You can see what's this? That's the disc space. You got to be more specific. Well, how do I know which numbers these are? Because here's the sacrum, 5, 4, 3. So L3 and L4, that's the L3-4 disc, or you can call it the L3 discs. But you don't call it the disc, you call it the disc space. Although I guess you can see a little shadow of disc in there. You can see it bulging out in the front a little bit. And what about this right here? That's the inferior end plate. Inferior end plate of L3. Superior end plate of L3. Look quite nice. And I think I got everything here. Anybody notice anything weird here? This patient has, see, this disc space is a little thinner, isn't it? So that's the thinning of the disc space is pretty strongly associated with chronic low back pain. So we'll talk about that in differential diagnosis. Lumbar spine when you get up to 8th quarter. All right, let's see if we got them all. So number 1, well, I'll let you, well, I guess I already gave them away, didn't I? Spinous, pedicle. So this would be the inferior articular. Oh, you know what? No, that's the inferior articular process here, meeting the superior articular process. The whole thing is the Z joint, or the facet joint. This 7 would be the pars interarticularis, because it's about halfway between the superior articular process and the inferior articular process. We got an inferior end plate of L3, superior end plate of L2, and that's the body of, I'm sorry, L2. L4, jeez. Inferior articular process, or inferior end plate of L3, superior end plate of L4, and this is the disc space, the L4/5 disc space. Wonderful. Can read through that. Oh, what do we got here? This doesn't look like an X-ray or a CT scan. Was just a fancy three-dimensional X-ray. This is called an MRI, and we are going to look at tons of these. You're going to see a lot of these when you get to my class. Every day we're going to look at different things. These are showing up more and more in the boards, we're told. So same deal though. Here's the sacrum. Okay, you can actually see the sacral segments. Remember, these start out as 5 segments when you're born. They fuse by the age of 20. They're completely fused into sacrum. There's L5, L4, L3, L2, L1. This is a young person, you can see, because the discs are nice and white. They're filled with water. This actually is called a T2 weighted MRI image. If this was a T1 weighted image, everything would be black in here. T2 weighted or weighting makes anything with water bright white. So the cerebrospinal fluid turns this thecal sac or dural sac bright white. You can see the cauda equina would be right here. And vertebral body, and these are the spinous processes, right? Spinous processes. Ligamentum flavum would be here. Well, where's the, like in an x-ray, this would all be colored in, because these are slices again. This is three-dimensional. So we're looking at a slice. I got the cut line in the wrong place, but the slice would be right down here, the middle. So we're looking at a slice through the middle, so you can't see the pedicles that come over. Now this yellow, this is a cut line again, goes right through the L4 disc. So if this patient was standing up and you sawed him in half with a chainsaw and you looked down at the stump to see the rings of the tree, this is what you'd see. This is an overhead view. It's really from underneath view. So who cares about that? That means that the sides are reversed if we're looking from underneath. So this is really the right side. This is the left side. And again, I'm not testing you on this. This is just for your own information. So here's I call this the slingshot in the back. It looks like a Y or a slingshot. That's the posterior arch. Here's the spinous process. Here are the facet or the lamina. The pars interarticularis in this view would be right in here. And here's our facet. This is the real facet joint. See the slit right there? There's another one right here. Real facet joint. Ligamentum flavum would be here. Now here, remember, there's no spinal cord way down here, right? You have a dural sac, which the cauda equina hangs in. You can actually see the lumbar nerve roots. These are the exiting. These are the let's see, this is the L4 disc. So these are the L5 traversing nerve roots. These are going to go down and exit below. And these are the S1 roots here. And then out in here, these are the traversing L4 nerve roots out here, right there. They're already out and exiting. So we'll get into all that. Here's the paravertebral musculature though, right? There's the multifidi muscle right here. Looks good. A little fat in here, but that's normal. A little more fat on this side, so it's got a little degeneration going on in these muscles, which is common with people with chronic back pain. All right. So overhead view again. We have the vertebral body. This outer portion is called the ring apophysis. It's important. Sharpie's fibers connect in there. Don't need to know that now, but maybe you do. Maybe Dr. Rosser wanted you to know that. But ring apophysis. Here's the vertebral foramen, or the central canal it's called. Here's a pedicle. And how can you tell, is this an I to S view or S to I view? Are we looking up or down on this cartoon here? We're looking down, so this is the superior part. Here's the superior articular process. There's the facet of the superior articular process. There's the mammillary process. Here's the lamina. Pars would be right in here. Spinous process, accessory process, mammillary process here. Transverse process, pedicle, pedicle. Boom, got it. Make sure you call this an axial view. It's also called horizontal or transverse view, but everybody calls it an axial view. Very rarely do I hear these words. Maybe in anatomy, but not in radiography. Okay, you can read about all that stuff. You might have to know this. I would hope you have to know this for Dr. Rosser's part of the class. I review it in differential diagnosis too, but I go pretty quick over it, so you better learn it now. So, okay, here's an MRI. Let's try. You can try your hand at it. I'll just be quiet for a minute. You can pause it. This is actually an interesting image. Okay, let's see how you did. So this is actually a view through the intervertebral disc. So this white area here, this is the nucleus pulposus, and it's surrounded by black. That's the annulus fibrosus, which corrals the nucleus pulposus. This is the descending aorta right here, number 9. What muscle do you think this is? Psoas major muscles are right there. Then we already talked about these muscles. You can see a little capsule separating them. Multifidi muscles. Out here we have, what's that one? Iliocostalis lumborum. Longissimus thoracis is right here. Where is spinalis thoracis? Well, we're down at L3, L4 here. So it's not, it doesn't show up yet. So it's not there. Okay. There's your answers. Thoracic vertebra. Pretty much everything's the same thing except we have some demifacets on the thoracic vertebrae in the middle of the spine. It has a superior and inferior demifacet. It also has a transverse costal facet, which is where the ribs articulate in. Okay, everything else is exactly the same. Oh, I'm going to back up quickly. So you're not going to be tested on this, but you need to know this before you graduate. You see anything weird with the angle of the facet joints? Okay, so this one is a little more coronal facing. This one is a little more sagittal facing. So this is called facet tropism. So people with these unequal facets, they have a higher prevalence of chronic low back pain than people who don't have these. So facet tropism. Okay, here's what view is this? Sagittal view. And there we see the superior costal demifacet, inferior demifacet is here. Remember now, if at T1 you don't only have one of these, so you don't always have two of them. There's that transverse costal facet there. Look at the spinous processes. They're much more vertical. Remember how we found the transverse process at 9 to 5? You had to go up two interspinous spaces and then go over to find the transverse process. Okay, what else we got? Here's an inferior vertebral notch, right? The inferior part of the pedicle. All right. Here's a PA view. Spinous process lamina is right here. And not much more. There's the rib actually coming in now with there's the transverse facet, you can see. And now here's a radiographic image. You can definitely see the ribs. Now, what are these, posterior ribs or what are these? What rib is this? Well, that's your T12 rib. Remember, your T11 and T12 ribs are kind of floating ribs. They don't wrap all the way around and articulate with the costal cartilage like rib 10 does. They just float in the back. So these are all posterior portions of the rib. So posterior part of rib 12, rib 11 posterior part. You can see, just like we saw before, there's the nose, so that's spinous process. Here's a lamina, another lamina. Pedicle, very white here. There's the pedicles. You always look. Cancer likes to eat away these pedicles or sometimes make it really white, so you always look at the pedicles. Okay, there's a quiz for your viewing pleasure. I think, are we done? This is a CT view. I'm not responsible for this, but thought I'd throw it in here. Now you can see the heart in here, and you can see some of the chambers of the heart. Pretty cool image. The lungs are right here. Why are they black? Because the ionizing radiation doesn't stick to anything. It's just the tissue is so weak. That's why it looks black. Plus air looks black as well. You can see something called a vacuum phenomenon in the disc space in people with bad arthritis sometimes. Anyway, I digress. So here's a rib coming in. There's the articulation with the transverse process here. And there's the articulation with the body here. Pretty cool. I could label this maybe. Well, this is the vertebral body. These are the pedicles, right? Pedicles. And this whole thing is the posterior arch. You can actually see the spinal cord right here. See the shadow of the spinal cord? Alright, I think I talked enough. And there you go, some great books. Well, you have that one. That's our chancellor wrote that one. It's actually a pretty good book. And Netter, of course, is good. Kramer, Bogduke. Alright, we'll see you. Now what are we going to do about So you're going to miss a review time is the only thing you're going to miss. So if you have questions about anything, just send me an email. There's nothing I can do for that because we don't have anywhere to make that up. But at least we made this part up. And I'm going to post a PDF of this presentation as well so you can view it at your leisure. All right, talk to you soon.